get started?
Yeah, let's get
Because
started.
there's going to be kind of a quick turnaround between the two sessions. We want to make sure we stay.
This is a high velocity workshop.
Yes. So,
Come on in.
all right, just in time.
You can start now.
So my name is Lisa again, and I am a co-founder and principal at Big Tomorrow, and these are my colleagues Jordan, and that is John over there. So we'll be running this workshop today, and I'll be our guest. And we do have a hashtag, Guest Experience Principles, GX Principles. If you are out there tweeting. And so what we're going to do today is a real quick introduction. We're going to walk through what the guest experience principles are, and then we're going to get interactive. And we're going to have you guys work in groups of 3 and kind of come up with your own ways of applying guest experience principles to a healthcare context. Then we'll do a quick wrap up and we'll move on to the next workshop. So that's what we're doing. So Big Tomorrow, we are an experience firm. We're focused on education and healthcare. And what we do is we help people uncover opportunities through research and need finding. We help people build new products and services, understanding everything from the service model, the software, the hardware, the environment that it's going to live in. So really taking a holistic view of a system. And we really focus on getting positive results, so making sure that we are measuring our impact and optimizing, evolving, and continuously learning, which I think is something really important and somewhat of a theme of this morning, so that's good. For us, it all started with a mouse, so thus be our guest. But my co-founders and myself, we worked on the Magic Band, my Magic Plus system. It's the largest Internet of Things project to date. And it included a lot of things. So everything from an RFID wristband that helped you go straight to your hotel room, that helped you walk straight into the park, that helped you get onto a ride, that helped you get food brought right to your table, to the exploring and booking and planning website, to the app that helped guide you along the way, to a map that lived on top of Google Maps but looked magical in its own Disney way. To also, very importantly, a bunch of staff applications that helped people help guests. So that it wasn't always a guest having to help themselves. There were situations where we decided that actually is a very bad experience. So there was a lot of thought and effort put into that side of it. And even at the sort of operational administrative side, a whole command center. So that if you had a really bad experience, for example, you went to get on a ride and it was shut down, but you'd already waited in line for an hour, you're not going to be very happy. You then go to eat dinner and someone brings you a free appetizer because they know that happened to you that day and they want to make it better. So that's kind of just one example of the ways in which the whole system was connected to really make people have a better experience and importantly also recover bad experiences. And so we at Big Tomorrow brought that experience that we had, and we wanted to leverage that in other settings that similarly are groups of people caring for one another. So that's why education, that's why healthcare. And one of the big products that we were able to build in the past year was for Clarify Health Solutions. So I don't know how many of you have ever heard of them. But what they do is they provide personalized patient pathways for hip and knee surgery recipients. And they do that through AI-driven analytics that really help understand how it should be personalized, working very closely with health systems to understand what their recommendations are, connecting a care team to them so that they have someone to speak to about different things in a more natural kind of way that's contextually relevant, and of course to provide a lot of personalized guidance. So it starts before the surgery and it takes them all the way through the recovery period. And that a lot of that's tied to the need for value-based care and understanding. I mean, it's hard, a lot of what they talked about today is how do you get feedback? How do you know what happens after they have the surgery? And this system was built so that you could know that, you could intercept, and you could make sure that people are moving forward in a positive way. So that's that. And now we will go into the principles.
All right, thank you. So we are going to, we've taken a lot of the work that we did with Disney, with a handful of other players in the hotel space, and our love of great dining and hospitality experiences, and distilled all of that thinking into what we call 5 guest experience principles. And we're going to walk through each of them, look at where they came from and how they applied in this Clarify project, and how there might be some broader healthcare applications. Hi, come on in. There is a seat, seats there, or right over here. Thank you. So the 5 principles are: make guests feel at home, anticipate every need, stay present, keep guests front stage, and plan moments in between. So first principle, make guests feel at home. Now, home means a lot of different things to a lot of different people, but fundamentally one of those aspects that we want to hone in on is kind of not asking folks to alter their routines and their habits all that much. Next slide. So I think one of the best things that I've ever heard in years of user research was showing Clarify for the first time to an elderly woman recovering from a knee replacement. And she said, I don't really use apps. You know, someone with an Android phone. She says, I don't really use apps. I just use the icons that are on my phone. And it was such a wake-up call, you know, just realizing that with this population, we had no way of bridging the technological gap, right? So it was not our job to show them how technology works, to educate them on what an app is, what a platform is, what how secure messaging works. No, we got to make this as simple as possible to fit her needs, to fit into her lifestyle as much. So we designed fully functional, like super cross-platform Android, iOS, a lot of desktop, even phone call as ways to interface with the Clarify system. Second principle: anticipate every need. This can there are often a lot of needs when it comes to healthcare, but it's really worth it to take the time and consider all those little moments, those little things that come up where there may be gaps. This photograph here, sorry. This photograph here is from a flight kit that you would get as maybe a bit of a business class or first class traveler on an airplane, but you see warm socks, you see moisturizer, a hairbrush, and some toothpaste for maybe those long flights where your body wants to be comfortable. With a lot of the, I think the biggest questions that we heard coming from people going through hip and knee replacements were things, were questions on the kind of recovery end of the spectrum of the journey. So how am I doing, and is what my body is doing normal? Does it fit into the kind of normal range? And initially we had a lot of charts and graphs and data that we could throw at people, tracking steps, tracking range of motion, et cetera, and kind of plotting you against the normal curve of how those things go. But really, we distilled it down to a lot more simple, straightforward of a message. Hey, you're doing, you're going a little slower than normal, you're in the normal range, or you're doing really well and you're recovering more quickly. And we can convey those things with just a couple, really visual elements that simplify the message quite a bit. So number 3, be present. And there's a really fine line between being overbearing and being present. But when if you're having a good dining experience at a restaurant, you're not constantly interacting with staff. They're not always up in your space, but it never feels like they're very far away. It may just take a nod of the head, or making eye contact, or raising a hand to get someone on your side really quickly. So we really tried to create the feeling that the doctor was with you, that the doctor was communicating directly with you, even if that wasn't always the case. Perhaps some of this was automated, perhaps some of this was coming from another care team member, but we came to realize that the doctor is a really, really crystal clear focal point to get a patient to focus on and help them not feel too lost in all of the care orchestration that's going on. So number 4, keep guests front stage. Is anybody familiar with this front stage, backstage analogy? If you've ever done design workshops before, this may have come up. It's a very common way to talk about the way we orchestrate services. So there's the notion of the front stage. That's the guest experience. That's what the guest sees. The backstage, that's where the kitchen, that's where the dishwasher is. That's all the inside baseball that we want to keep away from the guest view to make them feel more comfortable and like they're not, in over their head or seeing things that are not for them. So we did this and clarified by really, really drastically separating the front stage, which was the patient interaction, the app that you took home with you to help you through your preparation and recovery, and the backstage, which is where all the analytics and all the modeling happen. So not only are those systems, there's no way to get to one from the other, but the visual design, the interaction design is very, very different because they're extremely different use cases. And then lastly, plan moments in between. Does anyone know who that is? Yeah. Has anyone seen Hamilton on Broadway? I haven't. Yes?
In Chicago.
In Chicago? Cool. I don't know if they were doing this in Chicago, but for a while in New York, they would actually come out ahead of time and do what they called in Act Zero, where this was a waiting moment. This was a time when there was building excitement, but not a whole lot of there wasn't anywhere to really focus it. And they found that they could make a better show by coming out beforehand and doing a little skit or offering some giveaways and things like that. So there are all these big tentpole moments in a hip and knee surgery. Might be an initial consultation. Another, the biggest one is going under and having the replacement surgery itself. And then there's a long recovery process for which there may be a handful of milestones. But in between all of those tentpole moments, there's a lot of opportunity. There's a lot of downtime. There's a lot of opportunity to help connect those elements together and to continue to add value to the patient's life, even though they may not directly be interacting with care staff or actively managing their care. So we did that by offering a whole suite of preparation tools that the family could get involved with, educational material, and then post-surgery, a really robust kind of physical therapy coaching, automated physical therapy type coaching to continuously gather data and understand how individual patients and then the population was recovering well. So quick recap of the 5 principles: make guests feel at home, anticipate every need, stay present, keep guests front stage, and plan moments in between. All right, so with that, we are going to tackle this question, and we have about 25 minutes, and then I'll let you introduce it, John.
All right, so we're going to do a little exercise now. Perfect timing. Got here just at the right time. Have a seat. So we're going to go through an exercise to imagine what it's like for a parent and a child to go through a hospital experience. And we're going to try to apply those principles that we just talked about very briefly. And we're going to have cheat sheets so you can remember what they are. And we have some materials on the tables, so we're going to try to make it as easy and interactive as possible. So first of all, we're going to break into groups of 3, and Jordan and Alicia will help do that. But already we have some materials on the table, sticky notes, pens, and some worksheets that each group will have one of those little piles of materials. And we're gonna have some journey pages, some blank pages with different parts of the journey, the tentpole moments of this hospital experience. We'll arrange those. We'll show you how that looks like. Then we're gonna imagine what it's like how many of you guys have kids? And how many of you have taken your kid to a doctor appointment? Everybody, right? So this is a particularly stressful time if your kid is really sick or has a severe injury. So we want to focus on this because we think it might bring out some more emotional, stressful moments. And then the goal is to see what we can do to help them feel better and relax and feel at home, right? And so what we're going to do, this is a typical design thinking type of technique. We're going to take sticky notes, which you each have in your groups. We're going to take those big markers, They're intentionally really big, so you can't write like tons of little tiny words. And we're going to write one idea per page, per sticky note. And we're going to put those next to each phase, each big tentpole moment. And at the very end, after we go through all the different principles, we'll have a little bit of time for your group to sort of highlight the most important ideas that you got out of it. And then we don't have time to do a big share out. Usually you would share out and everybody would say, oh, this is what my group did. Since it's such a short session, what we're going to do is we're going to collect all of your materials, and then we're going to, you can leave your email with us, and then we'll actually send you, we'll take the time to put it together, and we'll send you what we all got out of it. And we might have time to go over a few of the best ideas too. But the point is for all of you to just dive into it and have some fun. And so first off, let's get into groups of 3. And you can just kind of congregate with the people next to you.
Yeah, 4 is fine.
I would join them. Maybe back there would be easier.
Okay. So yeah, the first thing we're going to do is we're going to arrange these 4 blank pieces of paper in front of you. This is kind of the journey, the patient and parent journey through the experience. And then what we're going to do is one at a time, we're going to kind of time box ourselves and be disciplined. But we're going to take the 5 principles. We're going to start with the first principle, and we're going to take 4 minutes. And we're just going to think about all these moments, all these big moments. Take the first principle, make guests feel at home, and just write ideas on the sticky notes. And you can talk about them with your group and put them on the whatever part of the experience makes sense. And then after 4 minutes, we'll switch the principle, we'll go to the second one. And you don't have to fill up all the sheets, and you don't have to write a ton of things. You know, quality is better than quantity. But just have fun with it, and just let the ideas flow. And we'll help keep track of time a little bit, and we'll prompt you with some questions, because this is kind of new, maybe abstract a little bit. So in the first principle, if you go to this, the first principle, we have some prompts here on this worksheet to help you think through some of the main questions that you might ask to come up with ideas. So in this case, where is the parent and child going to feel most out of their element and feel the most stressed out in this experience? And then what are the parts of the physical environment, objects, medical machinery, whatever, that make it seem foreign and scary, and what can you do about that? And yeah, basically what can you do using these principles, and go crazy, have fun, and we'll come around and float around and help you get through if you get stuck. All right.
So we'll take 4 minutes with the first principle, and then we'll move
It's usually how these design techniques tend to go out. Probably a check. Yeah,
Yeah, so you want maybe want to narrow in an environment that might be healthy. So
I have that in my mind. What do we have? Right here.
soft elements, they're all institutions.
And I was also sharing, talking about your ideas as you started.
I want to win.
I see you're color coding.
That could be arrival or check-in problem. There's a problem.
The point is to just like, if any of these are more conducive, like, for example, the exam might be one of the scariest parts for a child to see if it goes on and get prodded or
Okay, now's a good time to move on to principle 2, anticipate every need.
Yes.
So you don't feel like you're part of it.
Right.
We're going by first. We're going back.
Yeah, that one's actually, yeah, this one's being so.
Are they expecting
I think the way we want to recognize you see you in the list, identify You don't have to ask. Radio frequency. Better if they keep it well, even better is like, without have a little have your phone here.
Well, what else have you seen? Have you seen other examples of radio programming in hospitals?
I mean, usually you can make the everyone has involved in the patient.
Yeah, it's much more coded.
Assuming it's family-centered communication. I don't know if
That's totally. I know that's after they encounter it, but just before they leave.
Right. But they feel like, okay, I'm not doing this now. It's not
Because it can be quite traumatic seeing your kids being intimidated.
How do you address that?
My son was young, they said, I'm just going to listen to you.
So what could you do to the town during that segment where they need to
Aerosol. Right, now's a good time to move on to number 3, being present.
So what are the things that stand for you?
So maybe, okay, this is what the song is about. This is what's happening. Think about
well, what's currently happening, that's probably a big anxiety. What is currently happening is or attend to somewhere that information can be relayed automatically.
how might
I mean, you can feel free to throw like the other team over here was saying, like, oh, you can give them an iPad and it can have something on it. You can, we're not limited by cost or anything, it's what you can throw technology
So it's like, iPad or something that's in it. Your face is on your voice brought it over to be it's like so what people are going to come in and attach and then figure it out in the space. So say
I was from my an example of the way right now the doctors are often there like one training.
Yeah, and then you can
So check out
I've had it before. It's not like all of the adults are kind of serious. I don't get everything. More of a model. Next step is you need to go to the by the desk for doing it. But I think people think, you know, you're, and I also say screw. I also know you're pulling stuff right or maybe you get a little talking head, like whatever it says. Thanks for your visit here today.
Alright, we can move ahead to, I think, keeping guests front stage. So, how to be mindful of the boundaries between what the patient sees and
Almost. We got
Yeah, pretty good. It's always got the beauty
It's like we want to make it simple. We want to make it
I just saw that problem.
When they eat just do it and then we'll You want to questions about their hair. You're not getting
What happened anyone All right, let's move on to the last principle if you haven't already. Plan the moments in between. So how can you help connect the entire experience together?
Yeah, exactly. Yeah, that's exactly it.
It's a hard one. We gotta think about those things.
I can see why you did that. And then I'll go
I would take an exam between the wait time
Well, then we talked about like how do we minimize that pre-arrival, yeah, we And so then there's flexibility, like our provider has to like really sick kids, you don't have to wait for that room
Wrap up your thoughts. Write down your last great ideas.
So even
All right, so we've got about 5 minutes until the next session starts. So it'd be great to hear a couple of neat ideas. Star your top ones if you haven't done so already. But who has something they want to share from the exercise?
That can be your personal choice, your personal favorite.
Yeah.
we added a page.
What was your added page?
Waiting.
Oh, waiting.
Oh, yeah, good one.
So what happens during waiting in your experience?
It's a make or break experience for sure.
Yeah.
It's like DMV versus high-end airport lounge.
Yeah.
Yes.
That's awesome.
Yeah.
So it could really be make or break. So we put a lot of focus there, and our favorite idea there was probably, especially for kids, like maybe sectioned off little waiting pods so that they could be with their family instead of like in a large room with a bunch of strangers and people yelling and other kids screaming.
Yeah.
With like built-in entertainment a la, first class back of the seat touch screen little
Cool.
entertainment systems.
Cool. Thank you. Who else wants to share something?
We don't like the patient gown
Patient gown. Oh, okay. Yeah. Why not?
because there's something a bit humiliating about it. It's thin, it feels cheap, it
Yeah.
feels, it's kind of, it's classic least bidder, got the deal for it, it's been worn 1,000 times before you got there.
Yeah.
Did you have a solution?
A robe, a nice terry cloth robe.
Yes.
Nice.
With your initials on the pocket.
Can you warm it up for me before I put
And
it
it's
on?
warmed up,
Nice. Great. Who else? Can we hear from your group in the corner?
We, one of our ideas for checkout is to have a really friendly departure so that you have a good taste in your mouth as you leave, and not to see you soon or see you next time, but we'll see you on April 5th when you come in at 2 o'clock, just so that it kind of like helps you set up your next appointment as well.
Yeah. I think there's a concept in cognitive psychology, the peak end experience. The end is huge. That last moment really, really sticks with you. Yeah. How about your group?
Yeah, just kind of having an ambassador to sort of monitor that waiting period, and we were talking about maybe combining technology with the personalized approach where somebody has either their device or a device we give them that, every 10, 15 minutes or so that they're waiting kind of updates them on the status via the device, but then after maybe 2 of those updates, a person comes by and talks to them, and so it's not too much technology, but it kind of keeps them informed, and then the personalized touch comes in.
Love that. So you've got like an escalation point.
Yeah, exactly.
Yeah.
So they're not going too long without seeing anyone, but yet they're being given a status update.
Yeah, that digital personal divide is
Combo.
really, really powerful. Really powerful. All right, let's get one more cool insight.
So we were trying to tie together the 4 sections into one longitudinal story, and so we thought about the idea of them telling their own clinic story. And so probably with their own device, sort of in the arrival and check-in during that wait period, they're sort of designing exactly how they want to do the story. But use principles of the gamification so that the reward happens in the most scary part. So you get all the bonus points for during the exam portion, because that feels like it'd be the scariest part.
Cool. Yeah, turning it into a game, that's awesome. So here's what we're going to do. We have to kind of vacate for the next group. We are going to gather these pages. We're going to put together a kind of a readout that we can share with you all, anybody who's interested. We can collect your business cards if you want to see that final readout from this session, and we'll email it out in the next couple of weeks.
Yeah, if you guys put your business cards in here, I'm going to leave this here. We'll send you a readout of all the ideas. I also have some business cards here, and we have some printouts of a related article we wrote as well, if you want some more information.
And we don't actually have to vacate the room if you want to stick around for our next speakers, right?
Yeah.
Do you want to usher right into your session?
Yeah, we'll take 5 minutes to follow everyone.
5 minutes, okay.
Perfect. Yeah, we'll help clean up.
What is it?
Thanks, everybody.
Thank you.